United, please begin by introducing yourselves and explaining your rate request. We still have folks from. Oh, there we go.
Sorry, I was on mute. So thank you very much for giving us the opportunity to present our rate request. The first license that we will present would be the UnitedHealthcare Insurance Company. Before we begin, my name is Shamsher Plaha, and I'm the Senior Pricing Director with UnitedHealthcare. And let me start sharing my screen. So please let me know if you're able to see my screen.
We are, Shamsher, thank you.
All right. Okay, so again, this is for Oregon Small Group, effective 1/1/23. So we'll go the agenda that we'll discuss, the summary of the product changes for 1/1/23, and then we'll discuss some of the network changes that we have, summary of the rate request, rating factor changes, and the changes that we requested after submitting our initial filing. All right. So begin with a summary of product offering. So in terms of the plans for 2023 portfolio, we will be offering 48 plans. 28 plans are renewing from 22. And 20 plans are new plans introduced effective 1/1/23. 24 plans from 2022 portfolio that were terminated, and that only impacted actually just 5% of the membership, and they were mapped to comparable plans that will be offered for or effective 23. Okay, continuing on the product summary. So in terms of the member cost share, there were minor changes in the member cost share, predominantly for two factors. The first one was to fit into AV compliance because of the changes in the de minimis range. And the second one was we also lowered some of the or increased some of the member cost share just to manage our utilization increases year over year. In terms of new programs, so we are introducing actually two new programs effective 1/1/23. The first one is called United Healthcare Rewards or UHC Rewards Program. So this program really give financial incentives to members if they complete some of the wellness criteria that is set by the program. And that the UHC Rewards is available on all non-standard plans, so all plans except for the two standard plans that we have in our portfolio. The other program that we'll be offering is the Care Cash program. So this is a health rewards program, and that really incentivizes members to go to the more efficient providers or premium designated providers just to have better outcome in terms of the health. Moving on, the next topic we'll discuss is the network changes. So in terms of network, 3 of the 2022 networks will continue to be offered in 23, and those are mentioned here: Choice, our full network, Statewide, Narrow Network, Navigate again, statewide. So these two are continuing, and also the new network that we introduced in 2022, Nexus, that will also be offered, continue to be offered in 23. And this one is available only in 4 counties as listed here. The one narrow network from 2022 that will be discontinued, and that's the charter. And we have very minimum membership on that plan or on that network. And now comes the summary of the rate changes request. So starting with the legal name of the company is UnitedHealthcare Insurance Company. The rate increase that we are requesting is 4.2% 6.2%. And the range of our rate increases is minus 4.4% to 9.7%. And we do have overall small benefit reduction, that's negative 0.6% is the impact. Continuing with the summary of rate change request. Our quarterly trend starting 1/1/23, the quarterly trend is 1.6%, or on an annual basis is 6.6%. And this filing will affect almost 10,000 members as of March of 2022. Mentioned before, the total number of plans 48, new plans 20, and renewing plans from 2022 28. The rating factors that are revised in this filing from the last Q1 2022 filing are three factors. The one is the base rate. The quarterly pricing trend changed from 1.9% to 1.6%, or on an annual basis, 7.7 to 6.6, and plan factors of plan relativities. The next slide we have are the changes that we requested after the initial submission of a filing. The first one is the risk adjustment. So with the recent information on the risk adjustment, we increased our receivable estimates from 3.4% to 6%. And then also with the emerging experience that we saw, the trend factors we revised from 7.5% to 6.6%. And I think this concludes our summary of rate request for UnitedHealthcare Insurance Company for 1/1/23 small group market.
Thank you, Shamsher. Division staff will now lead a discussion about the division's review of the filings and the preliminary decisions.
Hi, thanks, Tasha. Good morning, everyone. My name is Ying Liu. I'm actuary of the division and the primary review of this filing.
Hi, everyone. My name is Drew Bucks. I was the secondary reviewer.
Okay, thanks, Drew. For the original filing submitted on May 13th, and the company filed 9.0% rate increase for the first quarter 2023. The minimum rate change was a 0.3% decrease, and the maximum rate change was 14.4%. And after the initial filing, CMS released the final risk adjustment payment result for 2021 in the beginning of the month, and the company updated the risk adjustment estimate accordingly from 3.4% receivable to 6% receivable, which resulted in a 2.5% reduction from the original filing. In addition, in response to the cost and containment initiative, the company lowered the trend from 7.5% to 6.6%. So with the aforementioned two changes, the company lowered the premium by 4.1% in total from the initial filing. And the total rate impact is 4.5% from the first quarter 2023 to first quarter 2022. And the 4-quarter combined rate impact is 4.2%. The division had a discussion considered since the company's rate is at the high end, and the decrease is very unlikely to disrupt the market and more likely to benefit the consumers. The division's preliminary decision is proof as filed with the update. When we review the filing, we look at, but not limited to, the experience, assumptions, methodology, and the calculation. Starting with the experience, the 2023 rate was developed based on the 2021 experience, and during the experience period, the company had about 126,000 member months with $63 million premium. the medical loss ratio was 83.6% before applying the risk adjustment. For the purpose of redevelopment, full credibility was given to the 2021 small group block business, and we consider that appropriate. Projecting into 2023, the following are the key items that are addressed in the filing. First, we noticed slight decrease in membership. The projected member months in 2023 is about 125,000 compared to 126,000 in 2021. The company's member months has been decreased in the recent years and since starting to stabilize. And the second, the pricing trend is 6.6% annually, equivalent to 1.6% quality trend after the company's update. And the trend analysis was done by cost and utilization, as well as by medical and pharmacy. The company's selected trend is within the reasonable range among all the carriers, and we have no issue with that. And also in the original filing, the company anticipated lower than market average risk score in 2023 and estimated 3.4% risk adjustment receivable payment from the risk pool, and then adjusted to 6% receivable with the updated CMS risk adjustment report, as mentioned earlier. In the filing, no significant change in provider network and no change was assumed in demographics of the covered population, and no COVID impact is assumed in the filing from 2021 base period. The filing also includes administrative costs, which includes expenses, taxes, and fees, and a 0.6% before tax profit margin. As a result, the projected medical loss ratio for 2023 is 83.9%. And we consider the above assumptions reasonable and supported, and agreed on methodology and calculation as well. The preliminary decision is approved the 4.5% rate change as filed. So that's all from me. Thanks, everyone. And back to Tasha.
Thank you. United, do you have any additional information or comments you would like to make on these filings?
No additional comment, but thank you, Division, and thank you, Ying, for working with us. So, yeah.
Thank you.
We will now take any public testimony. As I mentioned, I don't think anybody signed up to testify, so if you would like to testify, please unmute and introduce yourself. Let me remind anyone listening that tonight, July 28th, is the last day for public comments. Comments can be submitted through our website, OregonHealthRates.org. Next, we will hear from United of Oregon, and we will pause briefly. Steve, am I good?
You're good. I just left it going since it's United
Okay.
still. Thanks.
Okay. Okay, United of Oregon, please begin by introducing yourself and explaining your rate requests and giving your presentation.
All right. Thank you very much, Division, for giving us the opportunity to present our rate request for UHC or UnitedHealthcare of Oregon license for small group market effective 1/1/23. My name is Shamsher Plaha, and I'm a senior pricing director with UnitedHealthcare. So in this filing, the agenda that we have is the summary of the products that we will be offering for 1/1/23 effective, network changes, summary of rate request, rating factors changes, and the changes that we requested after the initial submission of our filing. In terms of the summary of products offering, so on this license, we are offering just 2 standard plans, standard bronze and standard silver. And these plans are continuing from 2022. No plans were discontinued or no new plans were added in 2023. And these plans are offered on a full network choice. and this is same as we had in 2022. Summary of rate change request. The legal name of the company is UnitedHealthcare of Oregon. The annual rate change requested is 6.7%, and the range of the rate changes is 6.1 to 7.3%. Other elements of rate request, the quarterly trend that we are requesting starting 1/1/23 is 1.6%, or on an annual basis is 6.6%. On this license, we do not have any members as of now, so it will not affect any membership. In terms of the portfolio, again, we'll have only two standard plans, standard bronze and standard silver. The factors that we revised since our last filing, three factors: one, base rate. Then second is the quarterly pricing trend changed from 1.9 to 1.6%, or on an annual basis, it would be 7.7% to 6.6%. And then plan factors of plan relativities. Changes requested since or after the initial submission of a filing. So two changes that we requested. The first one is the risk adjustment. With the more recent information on the risk adjustment, we are expecting to receive 6% of RAF payment versus 3.4% that was requested in the initial filing. And with the recent developing experience, we are lowering our claims trend from 7.5% to 6.6%. And this concludes our rate request for UHC of Oregon effective 1/1/23.
Thank you, Shamsher. Division staff will now lead a discussion about the division's review of the filings and the preliminary decisions.
Thank you, Tasha. Good morning. My name is Ying Liu, and I'm actuary of the division and the primary review of this filing.
Hi, everyone. My name is Drew Bucks. I was the secondary reviewer.
Okay. So the company requests 11.6% Q1 to Q1 rate change in the original filing, and similarly to the United Insurance Company, after the initial filing, CMS released the final risk adjustment payment, and the company updated the risk adjustment estimate from 3.4% receivable to 6.0% receivable, which resulted in 2.5% reduction from the original filing. In addition, in response to the cost and containment initiative, the company lowered the trend from 7.5% to 6.6%. So with those two changes, the company lowered the premium by 4.1% in total from the original filing. The updated rate change is 7.0% now from Q1 2022 to Q1 2023, and the full quarter combined is rate impact 6.7%. The division had discussion and considered, since the company rate is at the high end and the decrease is very unlikely to disrupt the market, instead will benefit the consumers. So the division's preliminary decision approved as filed with the update. Also, the company doesn't have any membership in 2021, and the rate development was purely based on the UnitedHealth Insurance Company's small group block of business, and also follow the projections as well. The proposed rate change also follow the UnitedHealth Insurance Company's small group rate. Since the company has zero experience, the division agreed with the way the company developed the rate. The division's preliminary decision approved the 7.0% first quarter from first quarter 2022 to first quarter 2023 rate change as filed. Thank you. That's all from me. Back to Tasha.
Thank you. Okay, United of Oregon, do you have any additional comments or information you would like to make on these filings?
No additional comment. Again, thank you very much, Division and Jing especially. So thank you for the review.
Thank you.
We will now take any public testimony. Once again, I do not believe anybody has signed up to testify, but if you would like to, please unmute and introduce yourself. Okay. Let me remind anyone listening that July 28th is the last day for public comments. Comments can be submitted through our website, OregonHealthRates.org. So please get them in by 11:59. Thank you. And that concludes this morning's hearings. We'll be back this afternoon for a couple more. Thank you, everybody.
Thank you.
Thank you.
Thank you.